Fortis Healthcare holds majority stake in SRL Diagnostics, but some partners at SRL are looking to exit. Shivinder Mohan Singh, Executive Chairman, Fortis Healthcare, says that the company is contractually obliged to give minority shareholders an option to exit. In addition, they're looking at O&M tie-ups with smaller hospitals to expand outreach. Here's a quick report.
Over the next many years, we will continue to expand our specialties offered at FMRI, and we're looking at doubling that capacity, taking it to a total of 1,000 beds, which we will do over a period of time. It's clearly the most advanced hospital in the country and in this part of the world, and we want to make sure we are continually staying ahead in terms of medical technology and the holistic specialty cover that we have for our patients. We're also looking at expanding our diagnostics business, where we have a central reference laboratory in Gurgaon, which really caters to all the high-end tests that we do across the country. So really from a healthcare viewpoint, we are very happy with what's happening in Gurgaon from a location perspective, right next to the international airport in Delhi, and we will continue to build and expand our infrastructure, our capabilities and our services within the state, not only to provide services to the people here and also to the people in India, but more importantly, we today get close to 35% of our revenues from our hospital in Gurgaon come from international medical tourism, and we see a huge opportunity there to be able to provide world-class healthcare at an Indian value price point, which is what we are doing and focusing on.
Right, so that has been your strategy of late. You've been focusing more on India, and you've been making a conscious effort to pull out from other countries. What sort of an investment are you looking at India largely per se, say over the next 2-3 years, in terms of expansion of capacity?
Well, if you look at where we are today at Fortis, we are very much India-centric, and we have taken a conscious call to focus our energies and investments only to the Indian market. And therefore, over the next 5 years, we will continue to expand and grow our existing infrastructure, our existing hospitals across the country, and we have the potential to more than double our operating bed capacity within our existing hospitals over the next 5 years. So we are going to remain India-centric, going to continue to make sure we are adding more specialities to our various hospitals, thereby being able to give a more comprehensive and a more holistic care to the people who come to us for treatment and for being healthy and well.
Right, while I understand you're not looking at any greenfield expansion, you're looking at doubling capacity only by way of brownfield expansion. You're also looking at O&M tie-ups. Could you speak to us a little more about that?
You know, there are a lot of people who've consistently been coming to us and saying, look, we've got the land, we can build a hospital, but we don't have the capability to run a facility. So I think with our expertise and our capability and being a leader in healthcare delivery across the country, we're also working with different partners and exploring opportunities where we can work with them to make sure we're providing world-class healthcare at an Indian price point in different markets where we currently are not there, but we will leverage our expertise through an O&M model there as well.
Right, so one last small question if I could put. The healthcare industry has been booming of late. There have been many companies that have been taking the route of public listing. You have SRL Diagnostics, which is still not gone into listing. Do you see that happening anytime in the future? Do you have such plans?
I think SRL is a great business. It's continuing to do exceedingly well. We are the largest pathology player in the country, and we are focused on being able to expand our network, increase our reach, deepen our penetration within the Indian market, and continue to provide world-class treatment to those people in terms of diagnostics that require them. We have a strong set of partners. Some of them, there is a time where they are looking for an exit, and I think we are working with them to give them the right exit, but there's a huge opportunity for us to continue to grow that business in the market.
You didn't answer my question. Are you looking at a public listing, sir? You speak about some investors exiting, so are you looking at getting public stake into the company?
Our focus is to enable them to get an exit, whichever form and shape that might be in.
So you're open to that idea?
We are working with them to give the 30% shareholders an exit.
Find us on Facebook at facebook.com/ETNow, and don't forget to click the like button. You can also follow us on Twitter at ETNowLive. To stay updated with all our programming, hit the subscribe button on our YouTube channel by logging on to youtube.com/user/ETNow.